This is a quantitative research proposal on the efficacy of cognitive behavior therapy for the treatment of eating disorders in a partial hospitalization program by Christy Aguilar, a Master of Arts in Counseling student at the Colorado Christian University. Eating disorders are serious psychological disorders. The eating disorders discussed in this research proposal are anorexia nervosa and bulimia nervosa. Anorexia is characterized as a restriction of energy intake which leads to significantly low body weight and an intense fear of gaining weight or becoming fat. Bulimia is characterized as recurrent episodes of binge eating followed by recurrent inappropriate measures to prevent weight gain. These measures include vomiting, laxative use, diuretic use, and also abuse of other medications to avoid weight gain. Anorexia has the highest mortality rate of any of the psychological disorders. For every year that an individual remains ill, the mortality rate increases by 5.6%. Bulimia also causes severe health complications such as heart arrhythmias, dental and esophageal problems, and even death. It has been said that cognitive behavior therapy is becoming the treatment of choice for the treatment of eating disorders. This research proposal is looking at the partial hospitalization program level of care. The partial hospitalization program level of care differs than an inpatient level of care because the individuals go home or return to their lives at the end of the day. A partial hospitalization program allows individuals freedom by maximizing the responsibility for their change, and it creates an environment that is not controlled or monitored as inpatient is. A partial hospitalization program minimizes the dependence on treatment because it allows the individuals to return to their day-to-day activities following treatment. There is almost no research on the efficacy of treatment for eating disorders. Researching the treatment outcomes of a partial hospitalization treatment program utilizing a cognitive behavior therapy approach for the treatment of eating disorders will fill a gap in the literature by conducting a quantitative study to determine if cognitive behavior therapy in the partial hospitalization program setting predicts relapse rates. There is an insufficient amount of research on the treatment outcomes and efficacy of partial hospitalization treatment programs that utilize cognitive behavior therapy for the treatment of eating disorders in adults. There are several articles and studies on treatment outcomes for different treatment methods. However, there is an insufficient amount of research on the treatment outcomes and efficacy of a partial hospitalization program that utilizes CBT. The purpose of this study is to determine the efficacy of a partial hospitalization level of care utilizing a CBT approach for the treatment of eating disorders in adults. Research question: does participation in a partial hospitalization program using cognitive behavior therapy to treat adults 18 and older with eating disorders predict relapse rates? There are many treatment methods for the treatment of eating disorders. CBT has increasingly become the preferred treatment method for the treatment of eating disorders. And there are no long-term studies on the efficacy of treatment approaches, including inpatient, partial hospitalization, or outpatient treatment methods. The proposed study examines how cognitive behavior therapy affects the treatment outcome of the eating disorders in a partial hospitalization setting. This design is non-experimental, and the purpose is to examine the cause and effect relationships of the secondary data that has been collected. Assumption number 1 is that CBT is the treatment of choice in individuals struggling with eating disorders. There are several other treatment methods used for the treatment of eating disorders. However, this is the best therapy to utilize. Assumption number 2. A partial hospitalization program minimizes regression and dependence among patients. A partial hospitalization program is more effective in reducing the recidivism in those that have received treatment for an eating disorder. The limitations of the study. There's no differentiation whether individuals have received treatment before. It only determines the efficacy by whether or not the individual relapsed or not. It also does not state how long individuals remained in recovery before they relapsed. The significance of this study is that it has the significance to potentially affect the work clinicians do by providing information on better treatment models for the treatment of eating disorders in adults in a partial hospitalization program. Research, design, and rationale. This proposed study follows a quantitative approach. This design is non-experimental, and the purpose is to examine the cause and effect relationships of the secondary data that has been collected. The population of the study is adults age 18 and older that are currently in a partial hospitalization level of care utilizing a cognitive behavior therapy approach for the treatment of eating disorders. In order to find the data, research studies from peer-reviewed journal articles were utilized, including the following online databases: Academic Search Premier and ProQuest Research Library search engines. Some threats to validity include accuracy of data collected. Randomization is not possible since the data has already been collected. The researcher also cannot manipulate conditions of the independent variable. Ethical procedures. All participants agreed to participate in the studies and were aware they are part of a research study. Any permission required by the owner of the data will be secured by written permission. In summary, eating disorders are serious psychological disorders that can have serious health consequences, such as heart arrhythmias, dental problems, esophageal problems, amenorrhea, and even death. This study focuses on one treatment, cognitive behavior therapy, utilized in the partial hospitalization program setting for the treatment of eating disorders in the adult population. This research study will extend knowledge in the discipline due to looking at the efficacy of the specific treatment modality and level of care utilized for the treatment of eating disorders in adults. In order to determine efficacy, a yes/no survey will be used to determine relapse.